Let's dive into the world of local anesthesia. Have you ever thought about why you can't feel any discomfort while your dentist is working on your tooth? Or maybe you've been curious about why, even though you're awake, you don't experience any pain during minor surgeries. Local anesthesia is the superhero behind these miracles. It's a type of medication that numbs a specific part of the body, ensuring you don't feel any pain. It's as if it has a superpower, used by doctors and dentists to guarantee your comfort during procedures. Could otherwise be quite painful. So how does this superhero work? The secret lies in your nerves. They are the electrical wiring of your body, transmitting signals, including those about pain, from your body to your brain. Local anesthesia functions by intercepting these signals, effectively turning off the pain switch in a specific location. Picture this, you're in a room with a noisy air conditioner that's dominating your hearing, but what if you had a remote that could silence only that air conditioner, while leaving everything else in the room unaffected? That's pretty much what local anesthesia does. It mutes the noise of pain in a particular part of your body without influencing the rest of your body or your consciousness. So the next time you're in the dentist's chair, think about the magic of local anesthesia. Now that we've understood what local anesthesia is, let's explore its various uses. Remember our superhero? It's not just there to keep you comfortable at the dentist. Its powers extend far beyond that. One of the most common uses of local anesthetics is, of course, in dental procedures. Whether it's for a simple filling, a root canal, or even tooth extraction, local anesthesia numbs your mouth, ensuring you don't feel any discomfort. But that's not all. Local anesthetics also play a crucial role in minor surgeries. These are procedures that are significant enough to require pain management, but not so extensive that they require you to be unconscious. For example, if you've ever had a mole removed or a minor skin procedure, you've probably benefited from the wonders of local anesthesia. Additionally, local anesthetics are also used in diagnostic procedures. For instance, if a doctor needs to take a biopsy, a small sample of tissue, to test for certain conditions, they can use a local anesthetic to numb the area and ensure the procedure is painless. These are just a few examples of how local anesthetics are used in the medical field. It's safe to say, our superhero is quite versatile. In the next scene, we'll delve deeper into the different types of local anesthetics. Stay tuned. Now that we've understood what local anesthesia is and its magic, let's delve deeper into the different types of local anesthetics. Each one has its unique properties and uses, and together they form a powerful toolkit in the hands of medical professionals. Firstly, we have lidocaine, often the first name that comes to mind when we talk about local anesthetics. It's the most common type, especially in dental procedures. If you've ever had a cavity filled, chances are you've encountered lidocaine. It's fast-acting, and its effects typically last for a short duration, making it ideal for quick procedures. Next, we have bupivacaine. This is a long-lasting anesthetic, often used in procedures that require a more extended period of numbness. For instance, it might be used in some surgical procedures or for pain management after surgery. It's slower to take effect than lidocaine, but its effects can last for several hours. Last but not least, let's look at procaine. While not commonly used today, this anesthetic played a significant role in the history of local anesthetics. It was the first synthetic local anesthetic developed in the early 20th century. Though it's been largely replaced by more effective anesthetics, it paved the way for the development of modern local anesthetics. These are just a few examples, but there are many types of local anesthetics, each suited to different types of procedures and patient needs. In the next scene, we'll summarize everything we've learned about local anesthesia. Stay tuned. While local anesthetics are a crucial tool in many medical procedures, like all medications, they also have potential side effects. It's important to note that these side effects are not common, but being aware of them can help you make informed decisions about your healthcare. Firstly, there's the possibility of allergic reactions. Although rare, some people may have an allergic reaction to local anesthetics. Symptoms can range from minor skin rashes to more serious reactions like difficulty in breathing. If you know you have a history of allergies, especially to certain medications, it's crucial to inform your healthcare provider. Secondly, nerve damage can occur. This happens if the needle directly hits a nerve during injection. While this is extremely rare due to the expertise of the professionals administering the anesthetic, it's a potential risk to consider. Symptoms of nerve damage can include numbness, tingling, or weakness in the area where the anesthetic was injected. Finally, there's the risk of systemic toxicity. This occurs if the anesthetic enters the bloodstream in significant amounts. Symptoms can include dizziness, blurred vision, or even seizures in extreme cases. Again, the risk is very low, but it's something to be aware of. While these side effects may sound scary, remember that they are rare and that medical professionals are trained to manage them effectively. It's always important to discuss these potential side effects with your healthcare provider before any procedure. They can provide you with more personalized information based on your health history and the specific procedure you're undergoing. In the next scene, we will summarize everything we have learned about local anesthesia. Stay tuned. While local anesthetics are generally safe, there might be rare cases where toxicity can occur. So let's discuss how such situations are handled. The first step in treating toxicity is to immediately stop the administration of the anesthetic. This prevents further absorption of the drug into the system, thereby reducing the risk of exacerbating the situation. The second step involves supportive care. This includes closely monitoring vital signs such as heart rate, blood pressure, and oxygen saturation to ensure that they remain within normal limits. Providing oxygen may also be necessary to ensure adequate oxygenation, especially if the patient is experiencing difficulty in breathing. In severe cases, a specific treatment known as intravenous lipid emulsion therapy may be employed. This involves the use of a lipid solution that acts like a sponge, soaking up the excess anesthetic in the bloodstream and reducing its toxic effects. It's also crucial to note that the healthcare provider is trained to handle these situations effectively. They will take prompt action to ensure the situation is under control. With prompt recognition and treatment, local anesthetic toxicity can be effectively managed. As always, remember, safety first. In our next section, we will summarize everything we have learned about local anesthesia so far. Stay tuned. In this segment, we delve into the world of local anesthetics and their side effects. Local anesthesia is a potent medication that numbs a designated body area, effectively turning off the pain switch in that particular region. It does this by obstructing nerve signals, thus deterring the sensation of pain. What's remarkable is that while this is all happening, it doesn't hinder your consciousness, allowing you to remain awake and responsive during the entire procedure. However, as with any medication, local anesthetics carry the risk of potential side effects. It's crucial to remember that all of this occurs when you are fully awake, ensuring your awareness throughout the process. In summary, the next time you find yourself in the dentist's chair or preparing for a minor operation, take a moment to appreciate local anesthesia. This unsung champion is the barrier between you and the possible discomfort of medical procedures, guaranteeing your comfort and freedom from pain. And that concludes our discussion on the importance of local anesthesia. From nerve signals to pain switches, we've delved deep into its critical today. However, bear in mind, this is just a fragment of the picture. The medical field is expansive and captivating, with infinite knowledge still to be unearthed. Hence, stay intrigued, keep probing, and continue your quest for learning. Until we meet again, continue your journey into the marvels of the human body.